And for the rest of us, UW Health is sending out a reminder that staying up to date with COVID vaccinations is critical.
Especially for people 65 and older as the vaccine protection wanes over time.
As usual, there's lots to discuss with UW Health's Chief Quality Officer, Dr. Jeff Pothof. Welcome back.
Dr. Pothof, good to see you.
Good to see both of you.
Let's start with the FDA panel. This is big news for young kids.
Yeah, there's a lot of news coming out of the FDA, this week. So the big news is really a vaccine finally available for those kids between the ages of 6 months and 5 years. There's a lot of parents that have been waiting for that, taking extra mitigation steps just to try to keep their kids healthy. Likewise, they're also looking at the Moderna vaccine for those older kids. That gives us additional options, especially if we get into boosters into the future. It's nice to have 2 options rather than just 1. So I think we'll see some movement and some things approved, and for those 6 month to 5-year-old kids vaccinated as early as sometime next week.
Pfizer released some of its data on its vaccine and showed that it was 80% effective for that youngest age group. But what is your advice for parents who still might be a little bit on the fence about whether that's what they want to do?
Yeah, I think, when I approach this, I realize that, kids are less likely to have severe disease than adults, but kids do sometimes get really severe disease. And even 1 or 2 kids having severe disease in the hospital or dying, like, boy, I'm not sure I want to take that chance. But likewise, kids do have other symptoms too, long haul symptoms. This could keep them out of sports for a while. It's pretty inconvenient to have COVID, and if you can reduce the chance of getting COVID by 80% so that your kid can, participate in all those summer activities with almost 0 risk to them from getting the vaccine, other than probably a day of being pretty fussy when they get that second dose, the benefits seem to far outweigh the risks. So I know some parents are like, I'm just not sure it's worth getting it scheduled. I think it's definitely worth getting it scheduled.
And there is a lot of COVID out there right now.
Why are there so many breakthrough cases?
Yeah, so we have these breakthrough cases because we have these variants that are different enough compared to original COVID-19, where even though our vaccines and even previous infections protect pretty well against severe disease, they're not able to protect against reinfection or infection with these new variants. So what we're seeing, especially with mitigation gone, is high levels of cases, but most folks having, moderate symptoms. They don't feel great that they have it, but they're not then progressing on to hospitalizations. They're not dying at the same rate as they were in earlier parts of the pandemic.
And that's why vaccines are so important.
Yeah, vaccines are really important because the most important thing they do is they prevent you from getting really, really sick. I mean, they can prevent death. That's pretty important. To a lesser degree, they protect you against getting any symptoms at all. And that's kind of a nice, side effect or benefit, icing on top of the cake. But if we had no vaccines, we'd only be able to rely on natural infection. We know that a lot of people, or some people, die when they get COVID. And that natural immunity, especially with some of these Omicron variants, may not last that long. You can get reinfected, sometimes 30 days after your initial infection. Certainly within 3 to 4 months of your original infection, you're prone to a new one.
If you've had your second booster, you're at the end of the line, right? In other words, you can't get another booster every 5 months. You're only approved right now for 2 after the 2-dose regimen.
Right now where we're at is basically a booster dose, a second booster dose for some of the population, and then what I think we'll see coming into fall is more global recommendations around what's the long-term booster strategy, and I think we'll see something where boosters are recommended at some sort of interval, maybe once a year, just to keep that immunity fresh. We're hearing news about hybrid vaccines with coverage for Omicron as well as kind of that initial strain. I think we'll get on some kind of cadence that more mimics what we see with flu shots, rather than what we're dealing with, in the recent past, which is, your 2-dose series, and then 6 months later another shot, 6 months later is another shot. I don't think it's going to keep up at that same rate.
Okay. And I think a lot of people are getting vaccine weary.
Yeah, I mean, who wants to get a shot every 6 months, right?
I'd gladly do it. All right, so if you're sick, stay home. Obviously, take a test.
Absolutely. If you're having symptoms, take a test. Know if you're sick or not. If you do have COVID, don't go out and infect everyone else. Otherwise, think about what you want to do or what you want to do a couple weeks from now. And, you might want to throw a mask on if you have vacation coming up in a week and you don't want to be sick for it. Or let's say you're going to go to a wedding and you don't want to be sick. It wouldn't be a bad idea, especially if you're indoors with a lot of people, to put that mask on.
Good advice.
Good advice, yeah.
Doctor, see you next week.
See you then.
Thanks for being with us.